In the age of Instagram, patients are being exposed to so many different treatments and they come in asking for treatments rather than the healthcare provider recommending the treatments. But the question always lies on what are the expected outcomes and why are the results different from person to person. So a lot of times you see a celebrity's done a treatment and you get it done, but you're not as satisfied or it's not what you expected. Why is this? Let's find out. I'm Dr. Nika Goyal, Chief Consultant Dermatologist and Hair Transplant Surgeon at Soul Derma Clinic, New Delhi. Today, I'll tell you all about variations in treatments and why they may not be for you or why you're not getting the result you expected. Now, the first thing we have to acknowledge is genetics. We are all genetically made up different. So, of course, a treatment I do or a treatment you do will not yield the same result. The way your body metabolizes a product, the way your body responds to a product doesn't necessarily have to be the same. It's not just about using something to give you an outcome, it's about a holistic approach. So when you talk about lifestyle, everyone's lifestyle can also vary, right? So the person that is a couch potato, not working out, not eating healthy, cannot expect the same outcome as someone that is taking good care of their body, their health, sleeping well, eating well. Now, also keep in mind environment. Now, cities like where we stay, Delhi, is so polluted, right? When Diwali comes around, when the crop cutting happens, there's a lot of pollution in the air, which will impact the results as well, as opposed to being in the mountains or the hills where there's a lot of greenery, good AQI, maybe the UV index can be lower. However, keep in mind, this is also an illusion. So sometimes in the hills, the sun exposure is a lot, even though the environment is cool. So we do have to take precautions according to the environment. There was a time when phenol peels were going viral over Instagram, and a lot of people with a type 3 skin type were getting these peels done. So now their skin tone is lighter than an Indian skin tone, and their environment is different from ours. So when you get such a peel done in India and you're out in the sun, you're exposed to the UV rays, that can be a disaster waiting to happen. So we do have to keep in mind that our environment, our skin type, and the country we're living in does make a difference. We should also take advantage of synergistic therapy, so procedures that work well together. So it's not just about doing one procedure to change your life. We should combine different modalities for the best results. So for example, if you're getting regular fillers done once in a year, you should combine energy-based devices. You can also add on peels for your skin quality and skin tone and texture. So all of the combinations of treatments will give you a better outcome in terms of your results. It's also important for your healthcare provider to recommend a timeline and a plan. We can't just blindly do treatments because we've seen them online. We need to make a plan which is tailor-made according to your skin type and your long-term goals. Skin care or even skin procedures are not about just a short-term gain. We want to keep aging gracefully, youthfully. We want healthy skin, and to do that, you have to make a plan. So I hope you found this video helpful. If it was helpful, share it with your friends and like the video, subscribe to my channel.